Medicare. Choose wisely.
Hello, and thank you for joining us today as we present Medicare, Choose Wisely. My name is Mark Gibbons. I am the President and CEO of RetireSafe. Many of you may already be on a Medicare plan, or you are getting ready to make the important selection. This process can be very confusing and overwhelming. By watching our presentation, we hope to make your selection process a little easier and less daunting. Our goal is to help you select the plan best suited for your current health situation. Again, thank you for taking time out of your schedule.
To get started, here are a few facts about Medicare. Currently, 67.7 million people are enrolled in Medicare. About one-third of Medicare enrollees have a Medicare Advantage plan, and 9.2 million people are eligible for both Medicare and Medicaid. You are automatically eligible for Original Medicare once you turn 65 and are already collecting retirement benefits from Social Security Administration or Railroad Retirement Board. You must also be a U.S. citizen or legal permanent resident of the U.S. for at least 5 continuous years. There are two options for the enrollment period. You can enroll 3 months before your 65th birthday to 3 months after, or you can enroll during the normal enrollment period, which is October 15th to December 7th. If you do not enroll in Part A when you first become eligible, you will receive a penalty of 10% of your monthly premium for twice the number of years you are eligible. This means if you are eligible for 1 year, you would pay this extra 10% for 2 years. For Part B, if you enroll late, the penalty amount will go up 10% for every 12-month period. If you wait 3 years to sign up, then you will have to pay 30% instead of 10%. This penalty can last for as long as you have Part B. Medicare consists of 4 parts. Part A covers hospital care, home health care, nursing home coverage, and hospice coverage. Part B covers medical insurance. Part C is Medicare Advantage, and Part D is a prescription drug plan. Original Medicare is comprised of Part A and B. You are automatically eligible for Original Medicare once you turn 65 and are already collecting retirement benefits from Social Security Administration or the Railroad Retirement Board. Like mentioned in the earlier slide, you are eligible for Part A if you are 65 and receiving retirement benefits. You can also be eligible for Part A under the age of 65 if you have a disability, end-stage renal disease, or amyotrophic lateral sclerosis. If you worked for at least 10 years and paid Medicare taxes, then Part A is premium-free, meaning you do not have to pay a monthly fee. Part A covers hospital care, home health care, nursing home coverage, and hospice care. Part A hospital care includes coverage over acute care hospitals, critical access hospitals, inpatient rehabilitation facilities, long-term care hospitals, mental health care, and participation in a qualifying clinical research study.
Part A home healthcare coverage includes part-time or intermittent skilled nursing care, physical therapy, speech language, pathology services, occupational therapy, medical social services, part-time or intermittent home health aid services, and durable medical equipment if ordered by a doctor. Part A nursing home coverage includes a semi-private room, meals, skilled nursing services, rehabilitation services, medical social services, medication received while in skilled nursing facilities, medical supplies and equipment used in skilled nursing facilities, ambulance transport if the facility does not have the means needed to provide help, and dietary counseling. Part A hospice coverage includes doctor services, nursing care, pain relief medication, social services, durable medical equipment, medical supplies, hospital aid services, homemaker services, physical and occupational therapy, dietary counseling, short-term inpatient care, and short-term respite care. There is no Part A premium costs if you paid Medicare taxes and worked for 10 years. You get or are eligible for Social Security or Railroad Retirement Board benefits. or you or your spouse had Medicare-covered government employment. If you paid taxes for less than 30 quarters, you would have to pay $458, and if you paid taxes for 30 to 39 quarters, you would have to pay $252. Part B is medical insurance, which covers services or supplies needed to diagnose or treat a medical condition and preventative services. Currently, the Part B premium is $144.60. Things that are not covered in original Medicare include long-term care, most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting them, and routine foot care. Medigap or Medicare supplement insurances helps cover co-payments, co-insurances, and deductibles. This does not include Part C, and you must have Parts A and B.
To join Part C, you must first be enrolled in Parts A and B. Medicare Advantage covers everything that Part A and B do, and depending on the Medicare Advantage plan, it can also cover more. Medicare Advantage is offered by private companies that have been approved by Medicare. The average monthly premium is $36. Depending on the plan you choose, it can be anywhere from $0 to $270 a month. The costs are determined by premiums, deductibles, co-payments, and co-insurance. Premiums, which are per month, plan premiums vary. You will still have to pay Part B premium to Medicare and the Part A premium if you have one. The estimated average monthly cost of Part C is $36, and the range can be anywhere from $0 to $481. You will also have to pay the premium for Part B as well, and the typical payment is $144 a month. It can be higher if you have a higher income. Deductibles, which are per year, and some plans charge an annual deductible and some don't. Parts A and B deductibles do not apply. Co-payments, most medical services such as doctor visits, many plans charge co-payments for the services and benefits you use. Co-insurance, plans set their own co-insurance terms and percentages. Insurances will begin to pay some of your medical costs after the deductible is hit, which will require you to pay a portion of the cost. The percentage of the final bill is what you'll have to pay, which is typically 20%. Cons of Part C. More than likely, you will have to pay two premiums. There are different rules for different plans and using providers that are not in the network. There will be a small pool of providers to pick from. Medicare Part D gives prescription drug coverage and is an optional benefit that is offered to anyone with Medicare. We'll add drug coverage to Parts A and B, some Medicare cost plans, some Medicare private fee for service plans, and Medicare medical savings account plans. The average monthly cost for Part D is about $30 per month, but that price can vary per plan. The cost for Part D payments will vary individual by individual and are based on things such as premiums, yearly deductibles, co-payments or co-insurance, cost in the coverage gap, cost if you get extra help, and cost if you pay a late enrollment penalty. Part D does not cover drugs that are not on the provided drug list, drugs that are covered under Part A or B, or drugs that are excluded by Medicare. It's important to enroll in Part D when you become eligible. Otherwise, you will pay a late enrollment penalty if you join later unless you have other credible prescription drug coverage or you get extra help. Here are a couple of common questions asked about Medicare. How often can I change my Medicare plan? You can change your Medicare plan once a year from October 15th to December 7th. And for Medicare Advantage plans, you can change it from January 1st to March 31st. What do I do if I work past the age of 65? Most people enroll in Part A even with employer coverage. If your employer gives adequate coverage, you should be able to delay enrollment in Part B without penalties. Added on the slide is a link on where and how to enroll in Medicare. RetireSafe would like to thank you for viewing this presentation. We hope this presentation helps simplify and inform you on Medicare Parts A, B, C, and D. Thank you again for tuning in.